Hello everyone and welcome to another episode of Infectious Conversations. This is WVU Medicine's Infectious Diseases podcast. And I'm your host, Dr. Mehta. I'm a clinical infectious diseases specialist and pharmacist, and I've been working at WVU Medicine for approximately 9 years. Whenever it's time to go back to school, parents often have a checklist of supplies that are required, such as new book bags, new notebooks, new shoes. But when it comes to knowing which vaccines your children need before going back to school, they might not always know. So joining us today, we have an excellent guest who's going to shed some light on back-to-school vaccines, Dr. Lisa Costello. And Lisa, you're a repeat guest, so thank you so much for being on the show again with us. We're really happy and excited to have you. Lisa, if you could tell everyone what your role is and also how long you've been working at WVU Medicine.
Well, thank you so much, Dr. Mehta, for having me back. I'm looking forward to having another infectious conversation. And I'm a pediatric hospitalist, meaning I take care of children when they're admitted to the hospital. I also care for newborns in the hospital. I've had the privilege of doing all of my training here at West Virginia University and have been a faculty member for now hitting over a decade. So wow. I love being from West Virginia, and I live here with my husband and my toddler, who I've had my own back to school checklist for her as she's in pre-K. So I think this is a really important time to be talking about this. So appreciate you having me on.
Yeah, we're always excited to have you. Now, I gotta ask you about one fun fact about yourself.
So I will say my fun fact that some people know about me, not all, is that I actually played basketball for the West Virginia University Mountaineers.
Wow.
So I was center guard, center of the bench, guarding the water bottles.
Oh, wow.
So I didn't get much playing time, but when I was on the team, we had great success. We're able to get into the NCAA tournament, and it was
awesome.
Wonderful to get to wear the old gold and blue and represent my home state team, and still a big fan of Mountaineer athletics, and it really helped me in the work that I do now, working in teams and helping others.
Oh wow, that's amazing. So you do it all. You're an athlete as well as a physician. That's so great. So going back to school vaccines, I want to start off by talking about why is it important for children to have vaccinations before stepping into the classroom?
This is a really important issue, and there's so much information out there around immunization. So I think it's really important that we're having this conversation, and for those listening to get information from trusted sources. And really, overwhelmingly, people choose immunization for themselves and their children. We also know that people are curious and they want to learn more. And that goes back to what you just asked. What are immunizations and how do they work? So I think when we talk about our immune system, immunity is really our body's defense against germs. And there's really two key ways in which our body can develop immunity. Mm-hmm. One can be through immunizations. The other is through being exposed or having that germ. And immunization really is the safest path towards gaining that immunity, because if you have the germ, you are having the potential serious complications, unfortunately, even death from these diseases that we're exposed to, or these viruses or bacteria. So by having immunization, immunizations work like teachers, if you will, since we're talking about back to school. So when we get an immunization, our body is learning how to build protection against that virus or bacterium. So if in the future we come into contact with it, our body will already have its defense system built up.
Right.
And that's really why immunization is our safest way towards gaining that immunity, so that if in the future our body comes into contact, we'll have the defense mechanisms to be able to fight it off. And again, immunization is the safest way to gain that immunity versus getting the disease or being exposed to the virus or bacteria and getting the disease itself. And so that's why a lot of the immunizations we have are targeted against viruses and bacteria that are really causing severe disease or death. So when we talk about polio, last time we talked about measles, diphtheria, those are some of the examples of germs that we have immunizations against so that we can gain that protection more safely.
Yeah, absolutely. I think that's such a great point, because I'm sure people have heard about the chicken pox parties that happened a while ago, where if one child got chicken pox, they would kind of round up the children together. But that does run the risk for complications, and it can also cause complications down the line. So a child might get chicken pox, but then that may set them up for developing shingles, and that could be 20, 30, 40 years down the road when they're an adult, and that can cause severe complications as well. So I think vaccines, as you said, they're very important to protect people against this disease, but not only when they're children, some of these vaccines also help later on down the road as well. So I think that's such an excellent point. So what is the best way for parents to know which vaccines their children need?
It's always important, and I always encourage caregivers, parents, or whomever's helping the kiddos with that checklist getting back to school to talk to their healthcare provider. So pediatricians are familiar with having these conversations. I mentioned before, there's a lot of information out there.
Yeah.
So get information from trusted sources. Depending upon where you live, the specific requirements for what's required for your school system may be different. All states, including DC, which is not a state, but all states in the United States have some type of immunization requirement for school. And so it's really important to talk with your pediatrician, as well as knowing for where your child is going to be going to school, or in my case, pre-K,
Sure.
or even childcare centers. What are the requirements? And I really recommend families visit healthychildren.org. It's a website through the American Academy of Pediatrics, which is the world's largest pediatric focused medical organization. And there's really helpful information on there. And then, as I said, people may be curious to learn more about immunizations, and they can have those conversations with their pediatrician to know what are recommended immunizations and what might be the requirements for school entry.
Yeah, because there can be different vaccines that are recommended at different times. Like there's typically a timeline that children should have before they're doing different milestones, like being a certain age or going back to school. And so I think that can also help parents with that type of information as well, just knowing the timeline of the vaccinations as well.
Absolutely. The immunization schedule is recommended with input from experts in various areas to be based upon providing protection before an individual, notably children, would be exposed to those germs that I keep talking about. So the first immunization that's recommended is actually recommended within the first 24 hours of life, and that's the hepatitis B immunization, because we know that hepatitis B can be transmitted to the baby. And so by having hepatitis B and getting that protection, kind of starting to build that immunity early in life, can provide even lifelong protection. And there are also immunizations recommended based upon when our body's immune system is best able to start to build those defenses that we talked about earlier and build that immunity. So based upon the child's age, that's what helps determine what immunization they would be recommended to receive at that period of time. And that goes throughout the lifetime. You talked about how immunizations can also protect complications down the road. We know that as we get to different stages in our life, so there's different viruses or bacteria that we're more at risk for.
Yeah.
And so even as we get older, so we're talking about going back to school, this is really for children, young teens, young people throughout their lifespan. And
Yeah.
it's important to know, are you up to date on the recommended immunizations? And it's best to talk to your healthcare provider about that, and then go to trusted sources to get that information as well.
Yeah, and what can be related to that is just being in close quarters with other people. So when you're going back to school, you know that your child is going to be in a classroom with 20, 30 other kids. And even as you talked about getting older as well, so once people go off to college, they might be at risk for meningitis and things like that. So that can also play a role as to when vaccines are recommended in their life. One thing I really wanted to touch on is vaccine safety, because vaccines, they are effective. They're also very safe as well. Typically, they're going to cause mild symptoms after vaccinations. Those often can be local symptoms or maybe like a mild headache or a fever. But those serious complications, they tend to be very, very rare. So could you shed some light on vaccine safety?
It's a really important question, especially now, as many of the questions I receive as a pediatrician and quite frankly, as a mom, is, are these safe? And I will say right now, I, as a parent myself and as a pediatrician, I've looked at the science and have my own personal experience. I choose immunization for my child. There's so many things that I am unable to try to protect her from in just day-to-day life. We do our best. However, even walking has a risk. Nothing we do or consume is free of risk. Walking, riding in a car. And so when we're talking about the safety of immunizations, they have been studied over and over again and gone through very rigorous clinical trials in order to determine, are they effective? There's also ongoing monitoring of vaccines. And I think that's really important too. These are vaccines that are monitored so that if people have symptoms, they're able to be kept track of. And then when expert committees get together, they're able to look at that and to say, what are we seeing here? And I think that's a really important reminder to individuals, is that this is something that continues to have ongoing monitoring to ensure the safety and effectiveness of any particular immunization. And as you already said, most people might not have any symptoms at all or any reactions to getting an immunization. Some side effects that I frequently see are redness at the injection site or swelling or maybe a low-grade fever. However, some people may not have any symptoms at all.
And even in those cases, they tend to be self-limiting and go away in a couple of days or so.
Absolutely. They tend to go away very quickly. And then again, you're providing that protection. And when you're comparing that to getting a disease, if you would not have the immunization and you would not have those protection against that disease, you could talk about ending up in the hospital, getting a really bad pneumonia or lung infection that would require you to be put on a breathing machine. Or you mentioned meningitis before, where perhaps someone could get meningitis where the infection is around the brain and can cause brain swelling that then impacts our ability to breathe. And unfortunately, in many circumstances could lead to death. Or also lifelong complications. So I remember hearing stories of my parents, or even seeing some of my friends' parents have a limp from when they had polio because the polio vaccine wasn't available when they were younger. And so if you talk to some of those individuals who had those diseases and were able to survive, they've had lifelong complications. And in talking with them, choosing immunization and having a safe way to develop that immunity is something that they wish they would have had, so that they wouldn't have had to have the lifelong complication. Because for many of these diseases in which we have immunizations that are recommended to prevent them, we unfortunately don't have many treatment options for those diseases. So last time we talked about measles. A lot of these diseases that we protect against, if someone would get the disease, we don't have many options to help care for them. It's mostly supportive. That's why really it's important to prevent them altogether. And that's why it's important to have these discussions with your healthcare provider of what immunizations are recommended based upon their age. And then also in school, you brought up school settings or daycare settings, children play with one another. They eat side by side. They learn side by side. These are important aspects of education. That's important part of childhood or young people development. It also creates a situation in which people are spending a lot of time together in very close contact. And that is a situation that germs love because they're able to spread. And there are diseases that we don't have immunizations to protect against. And as a parent myself, I can attest the sniffles and the common colds that get passed around. And so that's why, particularly when we're talking about back to school, it's important to be up to date because we know that children and others who are in the child care setting are going to be exposed to more germs, and we want to have protection, particularly against those germs that can cause really serious complications or unfortunately even death.
Yeah, and I think it's great that you brought up measles like we talked about last time, but we're seeing that risk in real time. Like we're currently facing a measles outbreak, and a lot of those cases are in children, and the vast majority of cases are in patients or people who've been unvaccinated, about over 90%. And so we're seeing real time the risk of not being up to date on vaccinations.
Absolutely. I had hoped perhaps we would have seen differently since the last time we spoke. Unfortunately, we are still seeing cases of measles, and the elimination status that we've had in the United States since the early 2000s is potentially getting taken away because unfortunately we're seeing more and more cases of measles. And I think it's really important to talk about what you just said. In most of those cases, the people are not immunized or under immunized. And even small dips in immunization rates can cause the return of infectious diseases. Measles is, as a West Virginian, the canary in the coal mine. It's the one that we really need to have 95% people in a community have immunity towards that particular virus to provide protection. And that's a question that I do sometimes hear is, well, I'm getting my child immunized. What should that matter for other children or other people? And that's the one thing about immunizations. Immunizations provide protections for that individual. It also provides protection for the community and people around us, because as we have more people in a community have immunity towards a particular germ, that helps keep that disease out. And when we see dips in immunization rates and dips in rates of immunity, we see these diseases coming back, measles being a prime example. And it's important because, as we've already talked about, depending upon someone's age, they may not yet be eligible for a certain immunization. I think it's also important to note there are some medical conditions in which people aren't able to get immunized. So I think I might have shared this last time, a child who's getting treatment for leukemia, they're having treatment to kind of make sure their immune system, kind of is weakened, and that's part of their treatment. And so they're not eligible to receive some of those immunizations. And so it's important that we have protection around them that can also protect them. And so that's where immunization helps provide protection for the individual and also provides protection for the community around that person, making all the more important in a school setting because, as we just talked about, they're sharing very close contact with one another, learning side by side, eating side by side. And so we want to do all that we can to protect them from getting these serious diseases.
Yeah, we want the children to be protected. We want their parents to be protected. And sometimes they have grandparents at home and things like that. And so we want the community as a whole to be protected.
Yeah, and I think of like the pregnant teacher or the person who works in the school as well, having protection through immunization that they can teach and be in that environment and do what they love and helping children grow and thrive in the school setting.
Yeah, definitely. Now, we've heard information about vaccine exemptions. So I did want to ask you, could you shed some light on exemptions and what qualifies as an exemption and what does this really mean?
It's a really good question, and there's a lot of information out there about a variety of topics surrounding immunizations. All states have immunization requirements as a condition for school entry. What many a times varies across states are what are exemptions for those. So what I was just hitting on a little bit are medical exemptions. So medical exemptions are important. In West Virginia, where we're primarily practicing and where we work and live, we only in our state law allow medical exemptions as a condition for school entry. That is actually the recommended policy by the American Academy of Pediatrics, in that we only allow medical exemptions as a condition for school entry. So I shared the case about a child who might be getting treatment for leukemia. Another example would be perhaps somebody does have one of those very rare allergic reactions to receiving a vaccine. We would want them to be exempt because we know that they have an allergy to that. And so that is a medical exemption. And West Virginia has that strong policy. And there's actually many states who have followed West Virginia's lead. So there's 5 states that have that policy, with more looking at it right now, frankly, because of what we just talked about with measles. There are many states looking to follow West Virginia's lead and have only medical exemptions as a condition for school entry. Some states allow non-medical exemptions, and those vary. However, from a stance of the American Academy of Pediatrics, really the best policy is to only allow medical exemptions, because as we just shared, when you see dips in immunization rates for any reason, it can lead to a circumstance in which we see these diseases that we've prevented through immunization return. And so it's really important to know where you live, what are the requirements, and hey, I get it. I'm a parent. I am a parent of a pre-K child. Parents are busy. I get it. We're running around trying to make magic for our children and our families. And in many situations, the school policy is what helps parents act on that intention to immunize. As I shared earlier, we know that the overwhelming majority choose immunization for themselves and their family. And so in some places where there might be non-medical exemptions, if it's easier to sign a piece of paper, individuals might choose that route, even if they are more likely to choose immunizations, because it's the easier route to get their child enrolled in school. And so that's why we know these strong policies where we only allow medical exemptions really are what help create communities that are safer, because it's helping to have immunization rates higher to hopefully prevent seeing those diseases such as measles.
Yeah, and we haven't yet seen that in West Virginia yet, thankfully, likely because of our strong policies that we have in this state. If parents wanted to know more about vaccinations or immunizations, or if they have questions in general, who would you direct them to talk to, or what resources are out there? I know you'd mentioned one earlier, but if you could just recap the resources they have available.
Yes, absolutely. And thanks for having me on this infectious conversation. And hopefully people have gained some information, because particularly on this topic, there is a great deal of information out there. And I will say, not all of it is accurate. There is misinformation, and even unfortunately in this space, disinformation, where people actively put out wrong information. So that can make it really challenging for a parent or a caregiver to know, where can I get this information? It's always important to have these conversations with your healthcare provider, your child's pediatrician. I have had this conversation with my child's pediatrician. And so I really think it's always important to go to your pediatrician, your family doctor, your healthcare provider. I also know that people want to get information at the touch of a screen. And so I really direct people to healthychildren.org, and that's run through the American Academy of Pediatrics, where you have pediatricians and also input from families, as well as people like myself, a pediatrician who's also a parent, and they help create that information that's in a way that individuals can perhaps more easily understand it, because this is complex science, and I get that. And as a pharmacist, the just complex nature of what we're talking about, and how a lot of these vaccines work and how they help provide protection for the individual and the community. So it's really important to talk to your healthcare professional, and I really recommend going to healthychildren.org. And then if you're looking for those state-specific requirements, go to your Department of Education, and many states would have that information in regards to what are the requirements for school.
All right. Well, thank you so much for that information, Dr. Costello. You've shared a lot with us today, and all of it will definitely help keep our children in West Virginia healthy, especially as they return back to school. Thank you so much for tuning in to this episode of Infectious Conversations about back-to-school vaccines. I was your host, Dr. Mehta, and our guest today was Dr. Lisa Costello. We hope you join us for our next episode. Thank you.